hopefully starting shortly. For the audio problems, hopefully it'll sound a little better. The mics actually weren't turned on. That might have been
Very good. So this should be sounding better. If you're having audio issues, just let us know in the chat and we'll get going soon. So please stand by.
Who knows what that will So, journalists online, we're trying another solution on this. Is it sounding any better now? What is going on today? Nothing at all. Shopping. Good. We can start in 10 minutes. We can try to figure this out.
fait sur Washington Post accusant d'avoir menti.
Yes, now, Mark, any better? Nothing stopping. This is an audio check. Breaking. Shopping bed. Press.
Mark 2, there we go. So there's an audio check from the room. Okay, finally we have sound from the room to the bridge. So journalists, you're going to be able to listen to us. We're a bit of an echo though, that's because my phone's on. Yep.
So it's sorted?
Sort of sorted. Journalists, we don't know if we'll be able to bring your questions into the room. We'll figure that out later. Worst case, it'll be a little choppy. But at least you can hear us. So we'll try to do better as we go. Okay? Stand by. Okay, stand by. We have a little bit of an echo coming from somewhere. Can we turn down? So this is an audio question from the bridge.
然后你还算说你告诉我放凉了。
这个玻璃是变色的，是这个玻璃的吗？是那个这个玻璃是那个。
But it was always fun. But sometimes 2 to 3 minutes you don't want Jamie snapping while you come. You've got AP, they're not so much into the market moving as it was. Dow Jones. Sorry? You want it to move up?
Eric, how are you? Good. Hello.
Hello.
Bonjour.
Good afternoon, everyone. Thank you very much for joining us for this press conference from WHO headquarters in Geneva. Those journalists who are watching us on Zoom, to ask question, you have to click raise hand on your screen. Journalists who are dialing in, please type *9 on your phone. And welcome to everyone watching us on our Twitter account. We had a little bit of technical issues while preparing for this briefing. Hopefully it's all sorted so everyone will be able to hear us well. And to ask questions. If that's not the case, then please switch on to watch on Twitter account. We have Dr. Tedros with us, Dr. Mike Ryan, and Dr. Maria Van Kerkhove for the regular press briefing regarding COVID-19. Dr. Tedros, please.
Thank you, Tariq. And good afternoon, and thank you once again for joining us in person and online. Today, I want to start by saying thank you to all our colleagues in the media. As providers of information, you play a vital role in the response to COVID-19. The fight against rumors and misinformation is a vital part of the battle against this virus. We rely on you to make sure people have accurate information about the threat they face and how to protect themselves and others. Now to the numbers. There is now a total of 95,265 reported cases of COVID-19 globally and 3,281 deaths. In the past 24 hours, China reported 143 cases. Most cases continue to be reported from Hubei province, and 8 provinces have not reported any case in the last 14 days. Outside China, 2,055 cases were reported in 33 countries. Around 80% of those cases continue to come from just 3 countries. We see encouraging signs from the Republic of Korea. The number of newly reported cases appears to be declining, and the cases that are being reported are being identified primarily from known clusters. Although few countries are reporting large numbers of cases, 115 countries have not reported any cases. 21 countries have reported only 1 case, and 5 countries that had reported cases have not reported new cases in the past 14 days. The experience of these countries and of China continues to demonstrate that this is not a one-way street. This epidemic can be pushed back, but only with a collective, coordinated, and comprehensive approach that engages the entire machinery of government. We're calling on every country to act with speed, scale, and clear-minded determination. Although we continue to see the majority of cases in a handful of countries, we're deeply concerned about the increasing number of countries reporting cases, especially those with weaker health systems. However, this epidemic is a threat for every country, rich and poor. And as we have said before, even the high-income countries should expect surprises. The solution is aggressive preparedness. We are concerned that some countries have either not taken this seriously enough or have decided there is nothing they can do. We are concerned that in some countries, the level of political commitment and the actions that demonstrate that commitment do not match the level of the threat we all face. This is not a drill. This is not the time to give up. This is not a time for excuses. This is a time for pulling out all the stops. Countries have been planning for scenarios like this for decades. Now is the time to act on those plans. These are plans that start with leadership from the top, coordinating every part of government, not just the health ministry, security, diplomacy, finance, commerce, transport, trade, information, and more. The whole government should be involved. We need a whole government approach. So activate your emergency plans through that whole government approach. Educate your public so that people know what the symptoms are and know how to protect themselves and others. Increase your testing capacity. Get your hospitals ready. Ensure essential supplies are available. Train your health workers to identify cases. Provide careful and compassionate treatment and protect themselves from infection. If countries act aggressively to find, isolate, and treat cases and to trace every contact, they can change the trajectory of this epidemic. If we take the approach that there is nothing we can do, that will quickly become a self-fulfilling prophecy. It's in our hands. WHO has published step-by-step guidelines for countries to develop their national action plans according to 8 key areas, which are supported by detailed technical guidance. We call on all countries to accelerate those plans, and we stand ready to work with them to do that. More funding is being made available to support countries that need it and that have plans in place. As you know, the World Bank, the International Monetary Fund have both made funds available to stabilize health systems and mitigate the consequences of the epidemic, the economic consequences of the epidemic, with a special focus on enabling access to critical supplies and equipment. I had also a very fruitful discussion with the President of the African Development Bank. This is funding that's available now to countries who need it, in line with WHO's strategic preparedness and response plan. These funds are essential for supporting the response now, but also for long-term preparedness. Although COVID-19 presents an acute threat now, it's absolutely essential that countries do not lose this opportunity to strengthen their preparedness system. We know people are afraid, and that's normal and appropriate. That fear can be managed and moderated with accurate information. Today, WHO has launched a new social media campaign called Be Ready for COVID-19, which urges people to be safe, smart, and informed. If you feel overwhelmed by fear, reach out to those around you. Find out what your community's emergency response plans are, how you fit in, and how you can help. There is still a lot we don't know, but every day we're learning more, and we're working around the clock to fill in the gaps in our knowledge. Ultimately, how deadly this virus will depend not only on the virus itself, but on how to respond to it. This is a serious disease. It's not deadly to most people, but it can still kill. We're all responsible for reducing our own risk of infection. And if we're infected, for reducing our risk of infecting others. There is something all of us can do to protect vulnerable people in our communities. That's why we keep talking about solidarity. This is not just a threat for individual people or individual countries. We're all in this together. And we can only save lives together. I thank you.
Thank you very much, Dr. Tedros, and apologies for little issues we have with the sound. I hope that those watching us on Twitter and online and dialing in can hear us very well, and hopefully they will be able to ask questions. I will remind everyone before we start with questions to ask only one. We will start with Catherine and then Gabriela. Catherine, please.
Thank you.
If you can just press the little button.
Oh, yes.
Thank you.
We hear and read
Could you please give us more details about that? Thank you so much.
So the question about pets. So we are, as we've mentioned it earlier, we are aware of a dog in Hong Kong that has tested positive for coronavirus. Initially, these are weekly positive samples that came from the dog. The dog is doing well, we understand. He doesn't have symptoms. It's an older dog that we know of, but it's only one dog so far. So we're working with authorities in Hong Kong. We're working with our colleagues at FAO and OIE. We're working with the partners in Hong Kong who are looking at these pets who have been in homes of people who've been infected with COVID-19, excuse me. We're only aware of this one animal that's tested positive, and he's doing well. So in terms of what this means for transmission, we don't believe that this is a major driver of transmission. We don't have evidence of transmission from the human to the dog or the dog to the human. But again, it's only one example of this, and so of course it deserves much more study. But we're working with the partners who can help us to address this question.
Could I just add that it's not unusual in emerging diseases outbreaks to find that animals can be transient hosts, or there can be involvement in SARS and MERS. We had similar issues. So it's always a question with an emerging disease. And we're back to the core question. Are animals intimately associated with the spread of this disease? And the answer to that is no. In this case, this dog is a victim, no more than others. And we need to establish quite clearly what part animals might play in further transmission. But that is unknown. But this is not an unusual or unprecedented finding. It happens regularly with emerging diseases.
Thank you very much. Gabriela, please.
Yeah. Thank you very much for giving me the opportunity to ask. Dr. Tedros, you mentioned that there are countries that are not taking this very seriously, and that or other countries that they said there is nothing to do. Could you mention those countries? And just very, very quick, if you can clarify if you have any evidence that coronavirus is seasonal. Thank you.
I'll take the seasonal question. So the question is this virus seasonal? So we've only known about this virus for 8 weeks or so, starting in late December, and now we're into March. So anything, we don't know much about what this virus will do over the course of a season. And so we've had some questions previously about what this virus will do in different climates and different temperatures. We have no reason to believe that this virus would behave differently in different temperatures, which is why we want aggressive action in all countries to make sure that we prevent onward transmission and that it's taken seriously in every country. But this is something that will be of interest. We have in the northern hemisphere, we have the flu season, which was ending fairly soon, and in the southern hemisphere, we'll have the flu season starting. And so it will be interesting to see what will happen in the northern hemisphere and the southern hemisphere. But to look at seasonality, you need to look at patterns over time, and we do need some of that time to be able to see what happens. So it's important that we aggressively look for cases, and so that we can understand the extent of infection and how that the virus behaves in different populations.
And it's important to explain that seasonality is driven by factors in the virus, its ability to survive in the environment, but it's also driven by human factors, which are the coming together of humans. And influenza and other respiratory diseases can spread efficiently in winter, not necessarily because of the temperature, but because human beings come together in closed environments, and therefore transmission is more facilitated. So in this particular case, we've seen this disease now in a number of different climates. Singapore is a very hot, humid climate, and the disease spread is coming under control. So we will need to wait and see. Mm-hmm. Do you want to?
Yeah, thank you. There are a good number of countries who have left this epidemics up to the Ministry of Health. The Minister of Health and the health emergency institutions. We're saying that's wrong. It needs a whole government approach. And I don't have the list now, but it's a long list. And that's why my statement today was focused on advising all countries on earth to trigger the whole government approach. So all sectors in the government are involved, and this should be led by the principal head of state or head of government, or the second person who has the mandate to coordinate all sectors. But governments alone cannot beat this virus. In addition to the whole government approach, the focus should be in mobilizing everybody, all citizens, to take care of themselves and to also take care of others, and to make a significant progress in the fight. And we're saying it's everybody's business, and that's how it should be. But it's a significant number of countries who are not mobilizing the whole government. I can give you the list next time, but I don't have the list now. Thank you.
Thank you very much.
Thank you very much. So we have a little bit of audio issues here, so I hope we will have a clean audio version available after the press briefing for those, and I can see on social media that some people are not able or were not able to hear clearly from the beginning, so there will be audio file, and we apologize one more time. Shoko, please.
Thank you, sir, for taking my question. Shoko Koyama from NHK. Regarding North Korea, as I understood, they have not yet reported any confirmed cases of COVID-19. Is WHO in touch with the authority of North Korea, and how concerned are you regarding this case? Thank you.
Yes, we are, and have had multiple contacts with our colleagues through our office in the Democratic People's Republic of Korea, and obviously the country is right in the heart of the epidemic zone in the region. So there are risks there, but we have no reports so far of issues. We are supplying, making available supplies, as I think colleagues in China are as well, and are ready to provide technical assistance like to any country. So it's very, very important that countries like DPRK are well prepared, their systems are well prepared, and we're ready to go in at any moment should there be a report of a case from the country.
And we had a very good discussion with the Foreign Minister of the Republic of Korea, and she expressed her willingness and readiness to help in any way possible if there is a need that or a support that the North Korea asks for.
Thank you very much. Jamie, then Shane, please. And then we will try to get a few questions from online. We are trying to sort out the technical issues. Jamie, please go ahead.
Hi, good afternoon, Jamie, Associated Press. Dr. Mark Lipsitch, an epidemiologist at Harvard, was quoted in the New Yorker yesterday saying that as many as 40 to 70% of the world's 5 billion adults could at some point contract coronavirus. I guess I just wanted to know, how is it really that dire in your perspective? And just with that in mind, could you also tell us what you know more about both asymptomatic transmission and whether or not surfaces could be a source for transmission? Thank you. The latest we have on that.
I could take a stab at the first part, Jamie. Yeah, I mean, we've had these numbers almost every week now for the last 8 weeks. And we need to, as I've always said, take each prediction into account. We need to know what data that's based on. This is usually based on modelling data, based on certain assumptions about transmission and about R0, and some assumptions about control measures or not. And certainly you can model with control measures or model without control measures. So I'd like to see the data and see what that prediction is based on. We will listen to all good science. Having said that, there are obvious real things happening in the real world that contradict that. If we look at China today, 20 provinces in China have today downgraded their public health emergency risk level. It's 20 of 31 have actually gone in the reverse. They've gone from red to yellow or from yellow to green. Now that's flying in the face of that prediction. I'm not saying which one is correct, but I'm telling you, in the real world today, China is moving back towards the green. In the 11 provinces in China today moved to green, which is their lowest level of risk. the 5 levels of risk. On the 29th of January, all provinces in China were at level 1 risk, the highest possible risk. Red, red. The whole of China was red. So there's hope in that. Today there were only 4 cases of, or yesterday, the last 24 hours, only 4 cases of confirmed COVID-19 infection outside Hubei were actually from China. Most cases outside Hubei in China yesterday came from other countries. So when I look at that, which is happening in the real world, and then I look at predictions, I need to look, and we need to look at both of those. We need to see what's happening in Singapore. And the DG has said it in his speech. This is not a drill. We need to fight. We need to fight now. Because our predictions will come true if we do nothing. So we have choices today. Some countries are stepping forward and turning to face the fire. And we need all countries to do that right now.
And the second part of that question, so the question around asymptomatic transmission and the role of surfaces. So we know that this is a respiratory pathogen and it spreads through droplets. And so these droplets that come out of our mouths and our noses if we cough, we sneeze, will move some distance and they'll settle on surfaces. And there are some experimental studies that are currently underway that are looking at how long these viruses will survive on different types of surfaces. And some preliminary results from that look like this virus behaves similar to the SARS coronavirus. But those viruses can be inactivated with disinfectants. So cleaning of surfaces can clear those viruses away, and that's important. The role of asymptomatic transmission. I understand why this is a very important question. It is a very important question to us as well. We know that this infection with COVID-19 causes a wide range of symptoms, including people who don't develop symptoms. What we understand is that because contact tracing is so strong in some countries, cases that have not yet developed symptoms are being identified by being PCR positive. And so these are people who are pre-symptomatic. So it's a few days before they develop symptoms. Now the question is whether or not those individuals can transmit to other people. We know that that is possible, but we do not believe that that's a major driver of transmission. And the reason we know that is because if we look at the actual epidemics and how these epidemics are unfolding, if they were a major driver of transmission, it would have caused much larger numbers of cases. The big question that we have right now is whether serology and looking at how many people have been infected overall and how many people are truly asymptomatic. That is, how many people have been infected but don't develop symptoms. And those studies are starting now. There are serologic assays that are in use right now. We are advocating for population-based serosurveys to be conducted so that we can have a better understanding of which proportion of the population has evidence of infection as detected through antibodies. But we do not believe that asymptomatic transmission is a major driver of transmission. It's still early days. It's still a few weeks into this outbreak. We're learning every day something new about this virus. That can change, as every statistic, everything that we say here, but based on the evidence, we're an evidence-based organization. We're taking the evidence we receive from countries. We're looking at all of the scientific papers that are coming out, and we're looking at the evidence. So right now, and what we know based on the evidence, that asymptomatic transmission is not a major driver of transmission.
Thank you very much. Shane, we'll go online. Shane, please.
Shane from China Central Television, CCTV. My question is, you just mentioned some countries are not ready for the virus, while you have also called for many times before that China's experience can be shared with the world, that the world can learn from China. And while China has been degrading much, most of its provinces, the risk of the COVID-19, do you think any approaches or mindset that can be shared specifically with the world or can be adopted by other countries? Thank you.
I think the DG has spoken to this many times. That was the whole purpose of having the joint WHO Goran international team join our Chinese colleagues, was to do exactly that lessons learned. And let me be clear, and I've been at this a long time, nobody has ever responded to an epidemic perfectly. No one has ever responded in perfect time with the perfect response. This is the real world we live in. Every emergency response is dotted with missed opportunities and unfortunate delays, and sometimes decisions that have to be made on limited data that subsequently turn out, you look back and you think, you know what, if we knew that now, what we knew now, we might have done something differently. So we need to be really careful, on the one hand to learn the lessons, and on the other hand not to say that exactly what happens in China needs to now happen exactly the same everywhere else. The issue is, what are the lessons? And the lessons I think we've learned from China and Singapore is to break down your problem, understand where you have just sporadic cases, understand where you have clusters, understand where you have community transmission, adapt your response to those needs, distribute your resources according to priority, be persistent, be consistent, be coordinated, be joined up. These are the things we need to see: command, control, coordination, coherence, and that the DG has been speaking to, an all-of-government approach. Community, society, public sector, private sector and government coming together to work together. And in weeks, and it's been shown, it can be turned around in weeks if that is what people are prepared to do. Now, the DG has said it many times, there are no guarantees with that approach. There are no guarantees that that can be achieved. But at the very least, that will significantly slow down the spread of this virus, allowing our health systems to catch up. And I think all of you have seen that health systems, even some health systems with a very small number of cases, have already struggled. They have already struggled to deal with the small caseload. So we need to get our health systems stronger. And one of the ways of doing that is to slow down the spread of this disease. So containment and control measures slow down the disease. So, but it's really important that we don't turn this into China was right about everything and someone else is wrong about everything, or everyone else is right, because there's been too much of this on both sides. We need to learn the lessons that have been offered, move on, because each new context is different. What we do in country X will not be the same exactly of what you do in country Y, because the context is different, the evolution is different. But there are wonderful lessons we can learn from China.
Yeah. I just wanted to say that one of the things we've learned is that the fundamentals work, the fundamentals of public health work, the fundamentals of identifying your cases, identifying your contacts. I'm an epidemiologist. This is epidemiology at its core. You need to look for your cases aggressively. You need to find all of those contacts and find those contacts. You need to mobilize your population. One of the things I was most touched at, if I could say, in China was the absolute drive of every single person we met. Every person of the population knew what their role was in this outbreak. They knew what they needed to do. They knew how they had to protect themselves, how they could protect their families, and what they needed to do collectively to bring this under control. We've said before, it doesn't, just because you have cases doesn't mean you're going to have clusters. It doesn't mean you're going to have large outbreaks. It doesn't mean that it's going to go out of control. We've seen not only in China, we've seen these fundamentals being used in Singapore, being used in Vietnam, being used in many countries, and they're bringing that back down. And it comes back down to these fundamental public health measures. And that is something every country can do.
Mm-hmm. No, thank you, Maria, and thank you, Mike. Just wanted to add, there is a common factor for all countries, which we call political commitment or political intervention. As you know, political intervention is like surgical intervention. It brings a paradigm. And meaning, if the highest level of the government, the head of state or head of government, starts to lead and coordinates all the sectors, that brings qualitative change in the way we respond to the epidemic. And that can be done by any country on earth. That can bring a new paradigm in each and every country. That's why in my statement today we focused on whole government approach. No government, no country has an excuse, because each and every country has a government. And that's what we're asking for. Take it to a